Hello, everyone, and welcome to our microlearn session training about sinks. On behalf of Project Firstline Rhode Island, we thank you for the impactful work that you are all doing for your various communities. My name is Chinam Sawadamegu, and I am a registered nurse. In my current nursing role, I serve as an infection prevention educator for Project Firstline Rhode Island, and it is with great pleasure that I present this training to you today. As a reminder, no nursing education credits are offered for this microlearn or any other microlearns in this series, but we are offering a certificate of training for today's session, as well as continuing education for dental IPC requirements and EMS. In order to receive this, please fill out the pre-session survey if you have not done so already. Abby will add that link in the chat for you. You would also need to complete the post-session survey that will be emailed to you tomorrow. Now, today's session is presented in a dual microlearn train-the-trainer format. Before presenting a microlearn, check with the policies and protocols at your facility and adapt the content accordingly. Incorporate microlearns into existing opportunities where groups of healthcare workers gather, such as pre-shift huddles or a team meeting. The session should be led or facilitated by an experienced team member with infection control expertise. The microlearns reinforce infection control concepts when risks are observed in patients or in the patient environment. Now, before we jump in, I just want to walk you through our agenda for today. We have already completed our quick welcome and introduction already. Next, we'll move over to our learning objectives. After that, we'll introduce our topic sinks and why we're even talking about them in the healthcare setting. From there, we'll dive a bit deeper into how sinks actually relate to infection prevention and patient safety. Then we'll go over some ways to discuss with your team some infection control actions, followed by a wrap-up and reinforcement of any facility-specific protocols and questions, before concluding with a few announcements and our end-of-session feedback. Let's review our learning objectives next. These are our learning objectives for the session. First, understanding how sinks in your facility can sometimes pose a risk in healthcare. Next, knowing how to reduce that risk using infection prevention and control practices. Also being able to apply what you learn to your facility's policies. And finally, feeling confident delivering this microlearn to your colleagues. In regards to using the microlearn, the Project Firstline Infection Control Microlearns are a series of guided infection control discussions that provide brief on-the-job educational opportunities. Each microlearn focuses on a single infection control topic and connects infection control concepts to add immediate practical value. Healthcare workers can easily apply the key points to their daily work and perform the recommended actions to keep germs from spreading. Each microlearn contains a discussion guide and job aid that the facilitator can use as a resource to guide the discussion. Abby will paste the user guide in the chat for you to review at a later time. Now, the first step of teaching a microlearn is to introduce the topic. In this case, it's sinks. This is where you will discuss with your team members the topic of sinks and how it applies to your team of healthcare workers. When teaching a microlearn, it may be helpful to have your staff stop and think about the sinks in the patient or resident rooms at your facility prior to starting, and what potential risks they have encountered in the facility. Now, I'll give you guys some time. Please feel free to put in the chat some potential risks that you have encountered at your facility related to sinks or even your facility's water system. I'll give you all some time to do that. Now, the question again is, what are some potential risks that you have encountered at your facility related to sinks or even your facility's water system? Feel free to put your answer in the chat. I look forward to reading some of them. Okay. Clean supplies stored in splash zone. Okay, that's a good one. Faucet offset. Can we get one more? Poorly draining sinks or closed units where sinks aren't being used, pipes not being flushed. Great examples. Now, just as you all have done, okay, someone added improper liquids dumped, coffees, drinks. That's another good one. We'll discuss that as well. Now, just as you have all done, you can also have them take a moment to think about your facility's water system prior to getting started also. Some questions to consider include, how are sinks used and how often? Are they located near clean supplies? What liquids have you seen workers and visitors pour into the sinks? And how can you reduce the risk of splashes and sprays from the sinks in your facility? After setting the scene with your healthcare team, you can introduce the topic sinks and why we care to talk about it now. And here is why. We care to talk about it because a variety of germs can live and grow in water, including tap water. These germs can survive and continue growing in sinks and spread to patients. Sinks are also an ideal environment for biofilms, which are slimy layers of germs that grow on wet surfaces and can be difficult to remove. Biofilms can actually grow back quickly, so it's important that sink areas are cleaned regularly and disinfected and free of standing water. Now, once you introduce the topic of sinks, you will then expand upon the topic and discuss how sinks pose a risk in healthcare facilities. Next, you want to continue to reinforce the importance of the topic in the workplace and expand further on sinks in healthcare, such as never dump liquids like IV fluids or drinks down the sink because they provide food for biofilms. Facilitator note here, discuss with your team where liquid waste should be discarded and how it should be transported. When water is turned on, germs can splash several feet from the sink, even if you can't see the water droplets. These splashes can spread germs to countertops and nearby surfaces and equipment. This is why patient care items should not be kept near the sink and all splashes should be cleaned up as soon as possible. It's important also to store patient care items far away from the sink to avoid them from getting splashed when the sink is in use. Facilitator note here. Discuss who to contact if you find an area that needs a shelf or better storage to keep patient care items away from the sink and splashes. Next, as a facilitator of a microlearn, you can discuss with your team infection prevention and control actions that can help reduce the risk sinks pose in healthcare. At this point in the microlearn, you will discuss with your colleagues what your colleagues and staff can do to prevent risk of sink-related germs at your facility. These actions include being aware of splashes and sprays and wiping them up promptly, keeping patient care items away from sinks and splashes. Also, if you notice an area that needs a shelf or other storage to keep these items away from the sink and splashes, tell your leadership. Clean and disinfect surfaces and medical equipment near sinks, and never use tap water with sterile equipment or during procedures requiring sterile water. Now it's time to wrap up all the most important points you spoke about and review with your team your facility's policies and protocols of sink-related handling and other opportunities for education. At the end of the microlearn, you will summarize the information for your staff and discuss any facility-specific information. Information such as germs that grow in sinks can spread to patients and cause infections, but they don't have to. You can stop the spread of infection by being aware of the risks associated with sink use in healthcare settings and take action to prevent infections. Here you can take the time to share facility protocols that may be useful for your team and other opportunities for education. You can share contact information for people or groups your team can contact to report issues. Here you can see a visual created by CDC Project Firstline summarizing the key points of today's microlearn. This is a great learning aid that can be hung or handed out for quick staff education or as a supplement to a microlearn training at your facility. Abby will share a link to this for you to download. Now the key takeaway is to keep sink areas free of patient care items. Never pour liquids other than water, for example, IV fluids, drinks, in the patient care sink. Be aware of splashes from sinks to nearby surfaces, equipment, and care items. And make sure to clean and disinfect faucets, sinks, and nearby countertops regularly. Here are the references used in today's session. Okay, now please take some time to complete our end of session feedback poll. This will help us to improve future trainings to suit your learning needs. Okay. Now, if you would like a certificate of training for this microlearn and have completed the pre-session survey, please be sure to check your email tomorrow for the post-session survey. Once we receive that, an email will be sent to you with the certificate of training. If you need help with your microlearn presentation or have any questions regarding this presentation, please do send us an email. Also, if you have not already, please visit our Project Firstline online page and sign up for our upcoming webinars. Also, as a reminder, we do have a Drains Microlearn by Allison Thurber that will be occurring at 12:30, so right after this microlearn. Abby will share that registration link for you in the chat. We look forward to seeing you there. And with that, we conclude our microlearn session. Thank you so much for joining me. Bye, everyone.